the traffic increase in Nairobi and I suppose in other metropolitan areas. And I think it does worry us that we are coming back and thinking that we are in a state of normalcy. We are not. For example, here in Nairobi, you will find the malls and supermarkets are fully packed. We are still combating this disease. We have not yet registered victory against this disease. I think it would be foolhardy for us to relax and think that we are winning this disease, lower our guard, would be a very dangerous thing for us. We had said that we need to observe social distancing, we need to observe physical distancing, we need to exercise appropriate hygiene, hand washing, and we need to wear masks. But importantly, we need to stay at home if we really do not have to come into the city and towns. That seems not to be working with us as Kenyans now. We're seeing more and more Kenyans coming back into the metropolitan areas. Considering that we are still fighting this disease, this behavior, as I said, is dangerous and can very easily reverse the gains that we have achieved. And I want to caution the management of facilities such as the supermarkets, malls, and others that are not adhering to the measures that we put in place in terms of distancing and the number of people who can enter such facilities at any one time. These facilities face the risk of closure if they fail to abide by the guidelines of the government. Yesterday, I updated you on our coronavirus analysis and reminded you of COVID-19 containment measures targeting the estates of Eastleigh in Nairobi, Old Town in Mombasa, and other counties where movement has been restricted. We will continue to appeal to residents of these areas to observe the outlined measures to help in restoring normalcy. Please keep within those restricted areas and observe all the measures that we have put in place. We also want to thank those residents who continue to abide by these measures. We appreciate the action they are taking, and we want to encourage others to do the same so that we can be able to make gains against this pandemic and move towards the path of normalcy within the shortest time that we can. In order to accelerate the flattening of our curve, we are today introducing additional measures to contain the spread of the virus in the designated areas. These areas I am talking about are the two estates of Eastleigh and Old Town, where we had imposed the restricted movements in and out of these estates. These include prohibition of hawking, street hawking, and any form of hawking within Eastleigh and Old Town in Mombasa. Prohibition of gatherings of whatever nature, and continued closure of malls, markets, restaurants, and eateries in these two closed-off areas. Fellow Kenyans, we have observed that since we issued specific guidelines on reopening of eateries and restaurants, some of the facilities have complied to our protocols, while others have not. I am therefore warning against non-compliance and state action that shall be taken against those who fail to follow the protocols provided by the government. We have elaborated on the protocols and procedures that need to be followed in order to reopen an eatery or a restaurant. These protocols, guidelines, and procedures are available on the Ministry of Health website, and they guide on what needs to be done to get your facilities opened. We have noted that a number of establishments, while complying perhaps with physical distancing requirements, may not have fully complied with the testing requirement of those employees within those facilities. All the requirements must be complied with. The facility must be inspected by a public health officer before you can go back into business. So we are cautioning those who have hastily reopened without complying with all of the requirements. And our officers will be going around to inspect these facilities. Those that do not comply will face the full action of the law. As pertains to our COVID-19 situation, over the last 24 hours, we have tested 1,611 samples. Of these, 28 have tested positive for COVID-19 disease. These 28 are broken down as follows. 24 of these are Kenyans and 4 are foreigners from Tanzania. This now brings the number of those who have tested positive in the country to 649. The overall number of samples that have been tested in the country so far stands at 31,041. The positive cases are distributed in the counties as follows: 10 in Mombasa, 9 in Nairobi, 4 in Migori, 2 in Kajiado, and 1 each in Machakos, Kiambu, and Homa Bay. It does concern us that we are beginning to see the numbers within some of these border counties of ours, like Migori and Kajiado, slowly rising. And it's a matter of concern, and this is where I think the issue of being able to test the truckers coming in becomes very important. All the 28 positive cases were picked by our surveillance teams. The cases are spread in the following estates in Nairobi: 3 from Embakasi, 2 in Eastleigh, and 1 each from Kayole, Huruma, South B, and Kawangware. The 10 cases in Mombasa are 4 from Vita, 4 from Nyali, and 2 from Likoni. The others are distributed as follows: Migori, 4, Kajiado, 2, and 1 each in Homa Bay, Kiambu, and Machakos. In terms of age, the cases range between 11 years for the youngest and 81 years of age for the oldest. By gender, 17 are males, while 11 are females. I'm happy to note we have registered 5 additional recoveries. This brings the number of recoveries to 207. Unfortunately, we lost 1 more patient to this disease in Mombasa, bringing the number of those that have succumbed to the disease to 30. I want to take this opportunity to express our heartfelt condolences for the family of the deceased, to the family of the deceased. The positive cases show that the virus is beginning to establish itself firmly within our communities. And in order to stop the cycle of transmission, I'm appealing to Kenyans to present themselves for testing and to observe the containment measures as advised by the ministry. To repeat again, these measures include regular hand washing, social distancing, proper wearing of masks, avoiding gatherings, and staying at home unless it is necessary or essential for you to be out of your home. Staying at home is one of the safest things you can do. Further, we note with a lot of concern the continuous identification of new cases in the border counties, in particular Migori and Kajiado. I have already alluded to that. We call upon the management of these counties to ensure that surveillance and screening procedures are adhered to in line with laid down protocols. In addition, the Ministry of Health will work very closely with these border counties and partners to support them in responding to this COVID pandemic, particularly in terms of being able to build capacity to be able to test for the virus at these points. Additionally, the ministry is working with partners and has sent a health support team to Mandera to conduct targeted testing of identified hotspots. So far, a total of 241 samples have been collected from these hotspots in Mandera and have been flown back to Nairobi for analysis. In due time, we should be able to be reporting the results of this analysis. Further, in responding to the increasing demand for testing by truck drivers, the Ministry of Health, in collaboration with County Government of Kajiado, is working on setting up a testing facility at the Namanga border point. On a different matter, let me take this opportunity to inform you that tomorrow, the 10th of May of 2020, is Lupus Awareness Day. This day is celebrated globally to raise awareness about lupus and to honor all those battling this disease. Lupus is a chronic autoimmune disease whereby the body's immune system becomes hyperactive and attacks normal, healthy tissues. I want to wish all lupus warriors well as they combat this disease, and to inform them that the Ministry of Health is working on a program to promote community awareness of the disease, even as researchers continue to look for a cure. Thank you.
Thank you very much, Mheshimiwa Waziri. Now it is your chance to ask questions, but before we do that, let me take this opportunity really to thank members of the press for the support and cooperation that we've been able to receive from you. Today really is about 5 or so days to 2 months. And in that period of time, we've been able to work together every step of the way. And indeed, a campaign like this requires that nature of cooperation. And therefore, from me, really just ask you that as we continue to battle this disease, the best we can do really is to expand and deepen that level of cooperation, because it is the only surest way that we can be able to effectively combat it and also be able to flatten our curve, because through you, we are able to empower the members of a society in as far as information about COVID is concerned. And with that now, I wish to open the floor so that you can be able to ask questions. Please remember to state your name and the media house that you represent, but also ask short questions to allow others the opportunity to also ask questions as well. So who would wish to go first? Yes?
My name is Charity Mwangi from NTV. We've received information that there are 2 cases of COVID-19 at industrial area prison, remand, and we'd like to find out if you are aware of this, and if you are, what are the measures that you have that will help combat this? Because the information that is reaching us is that there is panic in the prison, and so we need to have a quick address to this. Also, we'd like to find out whether you have plans to have
if you could move closer, just move closer, yes.
Diplomatic engagement with Tanzania, because we have seen that 4 cases of foreigners from Tanzania. How are you engaging with the Tanzanian government to combat this issue?
Next, yes.
Nancy Okware kutoka KBC. Kuna mtindo ambao tumeshuhudia katika siku za hivi majuzi, ikiwemo leo hii, ambapo idadi kubwa ya watu ambao wanapatikana kuwa na virusi vya corona wanatoka katika jamii, kumaanisha kwamba hawakuwa katika vituo vya karantini. Je, hii inamaanisha kwamba vipimo havifanywi pale katika vituo vya karantini, ama wale ambao wanapimwa pale wanapatikana kwamba hawana virusi hivyo, hivyo basi idadi kubwa ni wale walio katika jamii?
Steven?
Persons that tested positive who crossed over from Tanzania. What is their travel history? When did they come to the country, and how much have they interacted with people or Kenyans in Migori County?
I think that is all.
Okay, thank you. Charity of NTV. These 2 cases in industrial area remand prison, I am certain that our emergency operations center and the rapid response team must have been alerted and they must be aware of it. But I want to state that the correctional facilities are one of those high-risk areas that we have identified because of the nature of that facility and the closeness of the inmates. And it is definitely an area that requires attention. We have identified it as one of those high-risk areas, and part of our testing is really to be able to get into these facilities, work with the correctional prisons department and others in order to be able to determine, first of all, whether there is transmission of COVID-19 within these facilities, and then put in all those necessary measures that we require to be able to protect the inmates. So we are very aware of that, and it is part of the plan of the ministry in its response to COVID-19. The cases from how do we deal with Tanzania? Tanzania is a neighboring country, and we are all members of the East African community. And through that forum of the East African community, we are constantly in communication. We have virtual conferences with health ministers from the East African community almost on a regular basis to address issues of COVID-19 and issues at the border points. So we already have a forum that we talk to officials from our neighboring countries in order to be able to protect each other from the COVID response. So we do have a forum under which we work together, and we will continue to strengthen those fora that involve us, because you know, the community is one community. People will still move around. We have to move cargo around, and so we have to work together, and we do that. KBC, uliuliza hii virusi kwenye wale walikuwa kwa quarantine, sasa inaonekana hawana hii virusi, lakini wale wako kwenye jamii wanazo. Mwanzo wale walitoka nje ndio walilete hii virusi, vile unajua. wale wako nje wameinteract na watu wa nchi hapa, wameinteract na jamii hapa, na hii sasa imeingia katika jamii. Ndio tunaisema sasa hii virusi imeingia ile stage ya community transmission. Umefahamu? Community transmission maana yake iko katika community yetu. Umeona vile imesambaza katika sehemu kama Eastleigh, Old Town. Kwa hivyo, it's important for us to be able to contain the community transmission. In fact, it is community transmission that is the most challenging one to contain. You can contain the people who are coming in, the imported cases, because you put them in quarantine. But when it comes to community transmission, you are now talking about widespread transmission of the disease, and therefore your response is also going to be stretched to the limit. Even quarantine is going to be very difficult if this thing spreads widely within the community. And we must, all our efforts are aimed at containing that spread, to contain that spread, because if we are able to contain that spread, then we are able to limit the transmission of the disease. And we are able to push back the numbers as they rise, to flatten that curve and push it back in time, so that when we do get a rise in the numbers of people who are coming with COVID-19, we hope, one, the peak will be low, and two, it will be spread over time so that our health systems can be able to cope with it. If we get a curve that is steep, very exponential, and rises very quickly, it will overwhelm our health systems, which means people are going to die because they may not even have access to health facilities. Those who require the ICUs and the ventilators, the numbers may be so great that we will not be able to handle all of them with our health systems. So the idea, you've been hearing about flattening of the curve, and I know you as journalists are very aware because you watch what's happening around the world, is to continue observing the containment measures so that we can be able to smoothen this pandemic as it moves through the globe. The four Tanzanians, Stephen Latoy, citizen, the four Tanzanians from that crossed over into Migori. We have that data somewhere. I don't have it right here, so I cannot respond to the history of where they came, but we can provide it to you. I would believe that they are mostly people who are crossing over. You know, also in our border points, we have communities that are straddled across the border. We have families that live on one side of the border, they have relatives on the other side, and they do cross over. In addition to that, we have the truckers who are bringing in cargo. From Tanzania, most of the time, the cargo that is coming in is usually agricultural products and produce. So that information we will get for you, but we need to be able to strengthen and control those coming in. If they are truckers, then we need to be able to test them and have the same arrangement that we have put in place initially with Uganda, of a certificate of COVID-free that each trucker must acquire before they cross the border. They present that certificate, and with that certificate they can be able to come in. And it's a reciprocal arrangement. We will be expecting also to receive from Ugandan truckers that are coming in such a certificate, equally from Tanzania. We are working on that type of arrangement so that we are able to monitor what's happening at these border points. Thank you.
Thank you very much. That brings us to the end of today's media briefing. Like we said at the beginning, that we'll be doing this every day. So tomorrow again is another day, so see you again tomorrow. Thank you.
No, okay. Thank you. I need to sign it for you.
Yeah.